Let me tell you about someone I'll call Mark. Mark is 48, successful, married, 2 kids, decent shape. About a year ago, his doctor told him something a lot of men hear. Your blood pressure is too high. So he did what responsible men do. He took the prescription. Within 3 months, his numbers improved. But something else changed. His desire dropped. His erections weren't as firm, and he started avoiding intimacy. At first, he blamed stress, then age, then work. But deep down, he had a question he was almost afraid to ask. Is my blood pressure medicine killing my sex life? If you're watching this, maybe you've wondered the same thing. Let's talk about it honestly, because this conversation doesn't happen enough. Here's the truth most men aren't told clearly. Some blood pressure medications can affect sexual function. Not in every man, not always severely, but enough that it's real. And it's biological, not just in your head. An erection is basically a blood flow event. Your brain sends a signal, your blood vessels relax, nitric oxide gets released, blood rushes in, and it stays there. Now think about what blood pressure medication does. It lowers pressure, it changes how your blood vessels respond. Some classes slow your heart rate, some reduce nervous system activity, some change hormone balance. So yes, in certain cases, performance can shift. The biggest offenders? Older beta blockers. They reduce adrenaline, which protects your heart, but adrenaline also plays a role in arousal and performance. Some men on older beta blockers report lower libido, softer erections, delayed orgasm, and fatigue. Diuretics, the water pills, can also play a role. They may affect mineral balance and testosterone levels in some men. But here's the part that matters. Not all blood pressure medications are equal. ACE inhibitors and ARBs often have fewer sexual side effects. Some even improve blood vessel flexibility, meaning sometimes the solution isn't stopping medication, it's adjusting the type with your doctor's guidance. And that's a powerful distinction. Now let me tell you what happened with Mark. After months of frustration, he finally brought it up. He didn't say, "I feel off." He said specifically, "Since starting this medication, my erection quality has declined. Are there alternatives?" That changed everything. His doctor reviewed his case, they adjusted his medication class, they added moderate exercise, improved his sleep, and within a few months, not just better numbers, better confidence, better intimacy, better connection. But here's something important. Sometimes it's not the medication alone. High blood pressure itself damages blood vessels over time. If arteries stiffen, erections suffer. So you have to ask, is it the drug or the long-term vascular damage? Often it's both. That's why the real solution isn't panic, it's optimization. Here's what you can do starting this week. First, don't stop your medication abruptly. That's dangerous. Second, track what you're experiencing. When did changes begin? What symptoms? Be specific. Third, improve nitric oxide naturally. Leafy greens, beets, 30 minutes of brisk walking daily. Nitric oxide is the molecule that fuels erections. Fourth, lift weights 2 to 3 times per week. Resistance training boosts testosterone and vascular health. Fifth, prioritize sleep. Even 1 week of poor sleep can lower testosterone significantly. Small shifts compound. And let's address something else. When performance declines, even slightly, confidence drops, anxiety rises. Now you're in your head, and anxiety alone can make erections worse. So what started as a mild medication side effect becomes a psychological loop. Breaking that loop requires information, clarity, and action, not silence. Here's what I want you to remember. Protecting your heart should not mean sacrificing your masculinity. You deserve both longevity and vitality, and there are options, but you have to speak up. Doctors prioritize survival. They won't always prioritize intimacy unless you ask, and that's not selfish, that's smart. So if you're currently on blood pressure medication, ask yourself honestly, have I noticed changes? And if you have I actually discussed them clearly, not vaguely, clearly? Because sometimes the fix is simpler than you think. If this helped you see things differently, comment below. What medication are you on and what changes have you noticed? Your story might help another man who feels alone right now. And if you want more straight, science-backed conversations about men's health without the awkwardness, hit subscribe, because these are the discussions we should have been having all along. Your heart matters, your confidence matters, your relationship matters. You don't have to choose one. I'll see you in the next video.